Alright, so now we want to talk about studying. Excuse me. I feel like studying starts as early as you can. I know some people that say studying like for their licensing exams in their countries before they even wrote like the final exam for graduation in school. So it depends on which country you're coming from. Anyways, I'm talking about Nigeria, so let me be more specific. You can start studying as soon as possible. Usually the exams are in 2 batches per year or every year. So the first batch is usually between October and November. For this batch I wrote in, it was in November. Then the second batch is usually around, I think, March, April. Yeah, March, April. I think sometime April, yeah, March, April actually, that's official. Sometime within that period. So you have to plan ahead. If before you graduate, you can decide, you want to know if you're going to come back home to write the exam, so you can start putting things in order. If you intend maybe writing it by the second batch, because the first batch is October, November, then the second batch is March, April, about that time for 1 year. So if you graduate, say in what's it called, summer of the year, you may want to write it in October, November, that's the first batch, or you may decide to wait actually and write it in the second batch. That's no problem. So you have to plan ahead of time, know what you want to do so that you can start preparation early, because it helps. Yeah. So about study, well, I'm going to try and list out the study, should I say prerequisite or whatever. Self-study is important. Though first of all, I feel like you should know yourself, know what works for you. If you study, if you pick things more when people are talking about it, then you want to do the group thing more. If you're very self-studier like me, you want to stay on your own and try and study. But what our advice, regardless of whatever kind of way that works for you for studying, try and merge everything to get as much as you can. So self-study is important. Have your own timetable, what you want to study, what you want to cover up within a specific time, depending on how much time you have before the exam. And also look for tutorials. Really, tutorials help. You probably can do it without tutorials if you just know what's needed, get information like, okay, what do they need for the exam. Another thing, see, MDCN is not an exam to come up, oh, I like show stuffs. I know in Nigeria they're like, oh, you're moving stuffs, like, and the moving stuffs is like when you're really smart, like you're saying things, like hitting things, like when you're talking, I don't know what other word to use, other way to describe, like you're dishing things out. Maybe they ask you a question, you're saying it, talking about the what's it called, the molecular aspect of this, the anatomy, blah blah blah. Like you're just dishing things out, like actually that's what moving stuff is like. But yeah, it's not just really about movies, except when it's the exam. If it's when you're having word rounds, housemanship, yeah, you can be moving stuff, that's okay. But exam, it is structured, it is centered, like there are specific things you should be after. So this is not the time to try and read everything about medicine, probably things you didn't get to read before. No, this is not the time. Know what they need, what they concentrate on, and hit those things on the head. Like that's what you should be after. It's not the time to just be reading anyhow. Like it's good to read wide, actually, like read wide, but I feel like that's something you should have been doing before, not now during the exam. There are some specific things that you need to concentrate on. Then when you're good at those ones, then you cannot read extras to cover up for any loopholes. So tutorials is important. For me, it helped a lot because I was a novice. I didn't know anything about the MDCN exam and all that. So at the tutorial, you'll be able to know what to do and what not to do, what's expected, especially when you are at a good tutorial. Then I've talked about self-study, I've talked about tutorials, then I talked about group study is important. Well, that's one thing for me. I'm not really a group person. So because even in school, like most times, yeah, I can talk with people, like we can talk about something, it's interesting and I understand it better and it sticks better. But I always want to study first before I can talk to people about it, because if I'm just talking, I may pick 1 or 2 things, but it may not go deep because I haven't studied to understand it properly. maybe except someone explains it to me. But generally, I just like studying a topic or studying about something myself. Then after that, I can talk about it or hear people talk about it and all that. So I thought, okay, I'm just going to do the self-study, and with the tutorials I should be good. But I realized that gratefully I was able to, because someone kept encouraging me for group studies, like I should go for group studies. So somehow it worked out that I was able to get a group, join a group on my tutorial, and I realized that I could remember things more, in the sense that you can read, for instance, the guide. The guide is one of the books that you should read for the exams. Read the guide and you understand everything clearly and all that. But by the time maybe days later you're trying to remember, like you forgot, you just remember, oh, I've seen this thing before, but you don't remember what it is about, you don't remember what disease it's connected to. So but I realized that when I was with the group, when we talked about it, I kind of remembered it more, because I remember what this person's face looked like, what the person was saying, how we reacted when this person talked about maybe this disease or this condition, and it helped me remember more. So I realized that, oh, group study is a thing. As much as I should study myself, for me to be able to remember and recall, I should join a group, a good group, not the one that they just be gisting, but the ones that they're really centered. Then stay around people that are really studying, because like when you see people studying, you're like, or when you see people teaching out things, you're like, okay, so you're inspired to go study more and get on your feet. So yeah, so I'll talk about those group studies. Then the MDCN page on Telegram is top notch. Like, it's very important. It helped me personally, because even before I really got into the tutorials, someone added me to the group page, so I got to know what they, because that's why you're coming to a country, it's Nigeria, you have to know how things work here, especially in the medical aspect, how things work, what they expect. Don't just use your general knowledge of how you think medicine is in the country where you study. It's medicine, yes, but they are different, should I say, the practical aspect, what's expected, what they concentrate on, things like that. For instance, when I studied in Ukraine, systemic lupus erythematosus is a huge thing. Autoimmune disease, they deal on it very, very well. But in comparison with infectious disease like malaria, like typhoid, it's not really, they deal more on autoimmune, because that's what's common to them more. Malaria is not common to them in Ukraine. So things like the treatment of malaria may not be something you will know, like on the tip of your fingers or at the tip of your fingers. But here in Nigeria, malaria should be something the pathogenesis, cause, etiology, transmission, and treatment for different people, for pregnant women, for sickle cell disease patients, and all that. You should know that, because that's what's common to Nigeria. So those are things you should put in mind. So it's not just you may be a baddie, like, I'm sorry for using that word, but you may be like really smart or intelligent, you're the one that knows all the diseases where you study, but when you come here, it's a regional thing. It's a thing about place where you are at that moment. What disease is common here? Sickle cell disease. We hardly touched sickle cell disease when I was in Ukraine, because it wasn't common to them in Ukraine. And you're studying in Ukraine, they'll teach you what they know, what's common to them. But sickle cell disease in Nigeria is a thing. It's very common, so you should know everything possible about sickle cell disease, from that to the treatment, to the signs, the peripheral stigmata, like the main things you see, the treatment, and also the investigation. So these are things you should understand that. So that's why it's advised that don't just think it's medicine. You were very good when you were in school in the abroad, so now when you come to Nigeria you think you're just going. It's not because there's anything abnormal, it's because this is another country, it's another region, and they work based on what, just like where you're studying at, they worked based on what was common to them. So when you come, you have to know how to adjust. Sometimes in physical examinations, the way they taught us to palpate in Ukraine is different here. So you have to learn how they do it here, because when the examiner is looking at you, he's not looking at, he doesn't know where you studied from, and that's none of his business. He just knows that you have to do it the way he is known. He knows how to do it. So you have to learn to adjust. Because it's the same thing when you're writing USLME or USMLE. I keep mixing those words. Or PLAB. You have to, do it how it's done there. So as much as it's medicine, but medicine can also be regional, like specific based on where you are. So that's something you should put in mind when you come back. Yeah, so that's about it. So those tutorials help because these people, they are in Nigeria, they know what the MDCN board exams need, what the areas of concentrations are, so they'll be able to, you know, help you narrow that real down. Then aside, okay, I already talked about the MDCN page, where you should follow that up really, because they usually post what's it called, MCQs, like they teach there. They will post some questions, people will answer, they can explain if someone does not understand, you know. Then the picture test, it also helped me really well for the picture test, because picture test is a part of the CBT exam, computer-based test, CBT computer-based test. That's a part of the whole exam. So I'll talk about the exams later. Then the CBT test, they have a picture test section where you see a picture of maybe a disease, maybe a person, actually, usually a disease, or sometimes they can give you a picture of placenta previa and then ask you questions with the options on placenta previa. What drug is used for the disease? Not placenta previa, actually, like if it's another disease, or what kind of management for this condition, things like that. So I learned that that section carries more marks for the CBT exam. So on the MDCN page, it helped me because they'll keep posting pictures, and then sometimes I didn't know a lot of things because I was a novice, so I'll just keep watching how people are answering and taking notes. Oh, this person said this, okay, this is this, and then sometimes I'll write some things down, and then, so I just kept following that page. Immediately I knew that, oh, for sure, Debbie, you're writing this exam. So I started, you know, following the page, checked all the, even some of the previous stuff they had discussed before I started following the page. Like I started following what was being done on the page. I went back a bit to know, you know, just it gives you a brief kind of general information about the exam, about the questions and all that. So it helped a lot. So those are like, I think that's four or five things. If I remember, I mentioned that I feel like those are things you should really sort out. Alright, so now we're going to talk about study materials that I would recommend. I would recommend that are really high notch for that. I may not be able to say everything, but if I can, I'll write down the list on the screen later, but I'll just mention the ones I can talk about now. The guide, as much as people say, oh, sometimes it doesn't come up, but it really helps you because you get to know what it is that's specific to Nigeria, medical system, or medicine in Nigeria. So so the guide has there are 4 of them, I think. That's pediatrics, the guide, surgery, the guide, obstetrics and gynecology, the guide, and medicine the guide. So you should have those ones. I really recommend that. That's what I used. Then there's also synopsis. Also, I think they're about the same specialties, medicine, pediatrics, and all that. So actually, for the exam, medicine, pediatrics, obstetrics and gynecology, surgery are some of the main. They are the main stuffs for this exam. And then, of course, you do a bit of community health. Not a bit, right? Community health is also a big thing here for the exam. Then a bit of psychiatry, and then a bit of general knowledge, actually. So but I think those 4 main specialties are the ones that they'll be concentrated more on. So after the guide, I talked about synopsis also. They have I think specialties too. Then clerkship secrets will help you with clerking. Then Udefia bonds, what's the word? Physical examination. You should also check that. The videos are on YouTube. You can check them on YouTube here. And there's also I think also lab values. Lab values is very important. That's something they also ask for the OSCE part of the exam. And then surgical instruments in obstetrics and gynecology. Those instruments are really important. You should also study that to know those ones. Then histology is important also. What's it called? Microscopy of over of different microorganisms, so like ascariasis, schistosomiasis, all these infectious diseases is top notch here because yeah, in Nigeria infectious disease is a thing, so really concentrate on that. Yeah, basically like tropical medicine, like those kind of issues, yeah, concentrate on that. Alright, so let me talk a bit about tutorials. Tutorials are really important, they help a lot. So I'll speak based on my experience. So I attended a tutorial. I'll tell you the name of the tutorial at the end. At my tutorials, it helped because I understood better what the dynamics of the exam was, and then especially for the practical aspects, clerking, counseling, physical examination was really important. So they taught us all the physical examinations as much as possible, and then the clerking, we had a lot of topics to clerk, and every day we do at least based on the schedule, a timetable, we will do a different topic, we'll click, and then counseling also. So they brought high yield topics and some extra topics also, just to cover up so that there be no lapses. So also the doctors that taught us, they will talk about they will help us with clerking. So that sometimes we'll go to a doctor and then clerk. The doctors were teachers because they taught us. So we'll go to the doctors and then clerk with them, and then if we clerked, they will correct us what we said right, what we didn't say right, if we're not fast enough. And another thing, the exam is also a thing of time, so you have to keep that in mind. Usually the clerking count on the OSCE stations are usually 5 minutes, so everything you do should be within 5 minutes. So yeah, we're able to clear all of that counts, and then physical examination they'll do it in class, then you come and practice and all that. So it really helped. Of course, you see a lot of people that are also writing the exams, so you're able to meet up with people and say, okay, can we practice together, can we have study groups together? So it really helped. Then of course we also had time for CBT, a computer-based test practice, and they'll teach you also. So really for me, it was really useful, it was worth it. Yeah, and then we also had mock exams. Another thing about the mock exams, it helped me because this was my first time. I was a novice, I didn't know what to expect in the exam. So having the mock exams helped me because they did it like very much close to how the real exam is. So it helped me know what to expect, and that was when I noticed also that Debbie, this exam is not just about what you know in your head. Sometimes tension can just mess you up. Sometimes you can just forget things. Sometimes you can maybe be distracted. Sometimes you're not fast enough. You don't finish before time. So it helped me understand a lot of things. Helped me know what to prepare for, what to look out for. So what my weaknesses were, and then I was able to work on them for the main exam. So we had about 3 mock exams. Yeah. In my center, like at my tutorial, the tutorial I attended, and it was really useful. So I got used to it. So I knew what to expect when I went for the exam. Everything wasn't just brand new. I wasn't just moving like JTC, especially when you're first timer. Anyways, yeah, that was that about that. Alright, so the tutorial I attended was ACE Medics. I think they have a branch in Abuja, a branch in Lagos, and one in Port Harcourt. So I attended the one that was close to where I lived, or in the city where I lived. Then there are other tutorials. There's med tutors, I think, yes, and there's NEET Med also. So there are a lot of tutorials, so you just have to kind of look for the one that has a good review, the one that you're sure that they'll give you what you need for the exam, and then maybe also finances also sure. Just check what you can afford in the end, and then try and cover up from other places for things that you may not be able to get if you're not able to afford what will give you everything. Yeah, but I feel like it's worth the investment though, just to do everything you can to make sure that you give the exam your best shot. So yeah, that's